Mr. Barnes, go ahead.
Very good. Thank you. Welcome to Emergency Response Committee special meeting agenda today for Monday, April 20th, 2020. Notice of the meeting was properly posted April 16th of 2020. I'll do a roll call. Mr. Matthews.
Present in the BOCC room.
Mr. Blau.
Mr. Barnes, this is Cody. I'm in for Mr. Blau today. I'm in the BOCC room.
Very good. Thank you. We'll make a note of that. All right, Mr. Taylor.
Here in the BOCC room.
And Mr. Davidson.
Present.
And David Barnes is online. Item number 1, discussion possible action to set date, time, and place meeting will reconvene. Event technical difficulties arise during the course of this meeting and cannot be corrected within a maximum of 30 minutes.
Make the motion for noon Tuesday. Second. Same room, same time.
Very good. I have a motion and a second for reconvening noon Tuesday, which would be the 21st, again in the BOCC room. And we'll do a roll call. Mr. Matthews.
Aye.
Mr. Compton.
Aye.
Mr. Taylor.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Motion passed. Item number 2, approval of minutes of April 6th, 2020. Everybody have those memorized?
Second.
Got a motion and a second for approval of minutes. Mr. Matthews.
Aye.
Mr. Compton.
Aye.
Mr. Taylor.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Motion passed to approve the minutes. Item number 3, discussion review possible action regarding presentation from emergency management, health, or safety professionals. Do I have a motion to open item number 3? Do I need that?
No, you don't need a motion. It's first agenda.
Okay, very good. All right, my report for today, the 20th of April. Again, persistence in preventative measures, including limiting travel and staying at home, is more important now than ever. President Trump's presidential disaster declaration is still in place, including all states, and we have received presidential memorandum approving 100% of the federal share of reimbursement for use of National Guard in Oklahoma and 5 other states. The presidential 3-phase reopening strategy is continuing to move forward. Additional information specific to Oklahoma County, including the governor's office and health department, et cetera, will be coming. I just got a weird signal on my computer. Can you guys still hear me?
Yep.
Yeah.
Okay. CDC, some specific guidance has been provided. Thanks to Mr. Blau sending me a copy of that. They're recommending wearing a cloth mask when around other people to help reduce potential spread factors and encourage all organizations to have continued their business continuity of operation plan. The U.S. Office of Homeland Security, in collaboration with Mexico and Canada, have agreed to extend the non-essential travel ban across their borders for an additional 30 days. And Oklahoma remains under a major disaster declaration and a catastrophic public health emergency. And this currently includes the public assistance category that provide funding for emergency protective measures and direct federal assistance for state and local governments as they respond to the COVID-19 emergency. As a side note, I'll be participating in what's called an applicant's briefing this afternoon. And that is actually historically, that's the first step in moving forward with reimbursements under a major disaster declaration and the public assistance category. So I should have more information and more specifics in regard to that after this afternoon. And it's my understanding, thanks to the efforts of Mr. Davidson and others, the Oklahoma County has registered for the CARES Act stimulus funding. And a reminder, this is not disaster declaration related funding. Some numbers: Oklahoma as a state is currently experiencing 2,680 positive test results, 923 of which are active. We have experienced 143 fatalities, with the largest numbers in Oklahoma County at 23, Tulsa County at 22, Cleveland County also at 23. And in comparison, there have been 84 seasonal flu deaths since September 1st. There are currently 68 Oklahoma counties with positive cases, and we know of 1,614 Oklahomans who have recovered from known COVID-19 infection. Currently 555 cumulative hospitalizations. They peaked at 560 on March 30th, and currently there are now true hospitalizations, not cumulative, but true, are 325. There are now 93 test sites open in operation around the state. Hours of operation and prerequisite requirements, if any, will vary in those locations, many of which require an appointment. And you can go to the State Health Department website for additional information. Oklahoma City County Health Department site, which is in Oklahoma City, still is requiring appointments for those who are meeting test guidelines. And the Oklahoma City County Health Department triage line to determine if you're a viable person for testing is 425-4489, available Monday through Friday, 8 to 4:30. Excuse me. Oklahoma State Department of Health has activated an online symptom tracker, which is a key documentation factor in the reentry process. The number of symptoms and the location and any grouping of that is a key factor that will be under evaluation. Under a gubernatorial declaration of a catastrophic public health emergency still in the state, and Governor Stitt has modified his executive order to allow elective surgeries to begin April 24th. Integris is reportedly beginning some outpatient elective surgeries today, and the allowance for all of those is based on a tiered acuity scale, so it will depend upon how urgent those situations truly are. And again, public safety answering points are still receiving positive case addresses, and that's due to a relaxation of the HIPAA guidance, and all they are receiving currently through the 911 public safety answering points is addresses, so that when first responders are responding, they will get that information. Projected peak for Oklahoma is now anticipated to be April 21st, and nationwide, the peak resource use continues to decline, and these metrics are based upon the information from Institute for Health Metrics and Evaluation, or IHME, and it includes full social distancing through the end of May. The Oklahoma National Guard is deployed in Oklahoma. They have been authorized to work with the State Department of Health on nursing home-related medical missions, and I'm aware of 175 members currently assigned to other tasks, including the Regional Training Institute, or RTI, where the governor's solution branch is meeting routinely, and additional members are assisting with the strategic national stockpile and distribution thereof, and some are also assigned to assist the health department with field assessments. DEQ offices remain closed, but the environmental lab is open to the public if people need lab work done. Oklahoma Department of Public Safety, as we've mentioned before, has suspended face-to-face services. Some licensing and handicap parking permit expiration dates have been extended, and some online license renewals are available. Latest report from Department of Corrections still remains at 5 staff members and 1 inmate having tested positive. In Oklahoma County, 574 positive test results with 23 fatalities. 395 of the positive test result folks have totally recovered. 22 positive cases now at Tinker, and there is restricted visitor guidance in place, and there are revisions in the available gates. For information regarding coronavirus or COVID-19, the Oklahoma City County Health Department nurse hotline can be reached at 425-4489, and the state 24-hour hotline at 877-215-8336. Helping Hands, which is a small healthcare provider for the homeless under the Mary Mahoney Memorial Healthcare Organization, is helping oversee testing process for the shelters in the metro area. And their primary mission there is to help ensure that they are properly performed and that follow-up is provided for persons needing such. There are multiple telehealth providers, both for physical and mental health, coordinating their efforts, and they're using nursing students who are needing training hours to assist with that under obvious proper supervision. alternative care homeless shelters involving the Homeless Alliance and Oklahoma County Social Services and other partners continue to work through agreements and contractual issues. And the City County Health Department is tentatively providing a path for supporting shelter efforts. And our own Christy Jernigan Marshall has been working through some of the details of that. Again, she remains very engaged in ongoing meetings and discussions and a wide range of activities. Alternative Care Site Initiative, which is not the same as the Homeless Alternative Care, still involves cooperative effort with the Oklahoma Hospital Association and the Oklahoma National Guard. And PPE is still a concern for first responders and healthcare workers, but supplies have been arriving and being distributed. And the Oklahoma County Emergency Management point of distribution remains in place and active. And we are utilizing our full staff and several of our volunteers. We have so far taken 4 deliveries and made distributions to approximately 50 jurisdictions and counties. That includes law enforcement, fire rescue, emergency management, plus OBU, UCO, and the Oklahoma County Jail and Juvenile Justice are also receiving materials through that distribution. City County Health Department is requesting donations of pen lights, gloves, gowns, coats, face shields, 95 respirators, glasses, biohazard bags, and hand sanitizers. Anybody wishing to assist with donations, encouraged to go to the Oklahoma City County Health Department website. Will Rogers rolled up, currently reporting a 95% reduction in passengers. Some severe weather sheltering reminders, and we do have a chance tomorrow evening, for some severe weather in central parts of the state and Northwest, is to maintain social distancing and make your plan early. Do not wait until impending severe weather conditions develop. Maintain overall awareness. Internal to Oklahoma County government continue to emphasize the use of ReadyOp, and the emergency declaration that was put in place March 25th is still in place. And the Oklahoma County Court Clerk's Office marriage license, I've not received any additional information, but I understand that they're still requesting that people bring their paperwork already prepared and make an appointment before you come. And thank you, Mr. Matthews, for determining that we had 34 people come through the door on Friday at the annex. Re-entry information for Oklahoma County and the reopening of FEMA representatives this afternoon. A few notable points. I'm sorry, go ahead.
We lost you about 20 seconds ago.
Okay.
You're back now.
I am back now.
Yeah, it was right after the 34.
Okay. Let me check something here real quick. I won't mention any names, but my Cox service really stinks sometimes. All right, am I back with you?
Yes.
Okay. Draft re-entry information or reopening information will be coming as soon as additional updates are available. And as I mentioned earlier, I do have an applicant's briefing with State Emergency Management and FEMA representatives this afternoon. A few notable points: Oklahoma Medical Reserve Corps is still soliciting for medical and non-medical volunteers with a variety of opportunities. Warning signs and symptoms of the virus are still intact, as we've discussed, and personal protective measures remain consistent. And I would again emphasize the Center for Disease Control is recommending that anytime in public or around other people that you do wear a cloth face mask. And we continue to see issues with false information and statistics, and encourage people to view those realistically and be careful with also numbers and projections and dates and times, as those factors are very dynamic and they are dependent upon things out in the future. So use prudent protective measures and continue to do so. Unless there's any discussion or questions, that concludes my report.
Motion to receive report.
Got a motion? Got a motion and a second. Roll call. Mr. Matthews?
Aye.
Mr. Compton?
Aye.
Mr. Taylor,
Aye.
Mr. Davidson,
Aye.
and Barnes votes aye. Thank you. Report accepted. Item number 4, discussion review possible action regarding presentation of VOCC departments. We have anyone present like to make a presentation, or did we receive any information from anyone?
You got Cowboy Keith rolling up.
All right.
Nothing new, except we are building sneeze guards for those counters that have to interact with the public. We have counters in place, or sneeze guards in place for the county clerk. We're working on the court clerk and also the treasurer. I hope to have things in place by the time reopening occurs.
Are those going to be temporary in nature, or are those permanent? What are they?
They can be removed, so put in place and removed, however you want.
Okay, I was just curious. Hey Keith, I was over at ICB earlier today, and I noticed you had the signs outside the elevators.
Yes.
For one person per car, but the elevator that I happened to get on when it opened up, there was a sign inside the car that said 2 feet
That's
per
correct.
elevator. So if you get that, thank you.
Any further discussion or questions for Mr. Monroe?
You got information from Grant Billingsley. Saturday we had a really good count. 1,208 county, 254 DOC, and 4 municipal. Today the count is 1,248 county, 253 DOC, 1 municipal. Not really sure what the 40-person individual jump from Saturday to today is, but we certainly had that jump. Now they're continuing to work those individuals up, and what we're presenting them to those that are eligible to the judges for OR or CV. So we're continuing to keep a lower population in the jail, and to my knowledge, we still have not had any issues inside the jail. So things seem to be going pretty good.
Very good. You think we attribute that to just nice weather and a weekend?
I could agree with a bunch of people being out this weekend, that's for sure.
Absolutely. All right. More question or discussion for the report via Mr. Davidson.
Motion to receive reports.
Second.
Got a motion second to receive the reports. Roll call, Mr. Matthews,
Aye.
Mr. Compton,
Aye.
Mr. Taylor,
Aye.
Mr. Davidson,
Aye.
and Barnes is an aye. Thank you. Item number 5, discussion review possible action regarding presentation from facilities management. Anything Mr. Monroe care to add?
Shaking his head no.
All right. Moving on to item number 6, discussion review and possible action regarding presentations from the Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor's Offices. Anyone present or have information to share from any of those elected officials or their departments?
I know that the Oklahoma County Court Clerk had a phone call last week with the Supreme Court Justice and with Judge Elliott. And it looks like maybe May 13th, they're looking at cranking trials and everything back up. So don't do anything other than that. But May 13th is, what is that, 24 days away, 5 days away.
Okay, is that in trials, I'm guessing?
Yeah.
Okay.
I don't know if that's going to open up with full-on juries. I certainly hope not. Bringing 500 plus individuals and stuffing them in a small room doesn't sound like a really good idea right now. Even 25 plus days from now, it probably may not be the best of ideas, but that's where we're at, and I think they're shooting for that date. So.
All right, very good. We'll continue to watch for additional reentry, reopening guidance and specific what other jurisdictions are doing in regard to that issue. Appreciate that, Miles. Any other updates from the elected officials or their departments?
Motion to receive report. Second.
A motion second to receive the report from the Oklahoma County Court Clerk's Office. Mr. Matthews,
Aye.
Mr. Compton,
Aye.
Mr. Taylor,
Aye.
Mr. Davidson,
Aye.
and Barnes is an aye. Thank you. Report received. Discussion possible action, determine next meeting date and time.
I think the regularly scheduled, Monday, April 27th at noon in the BOCC room is probably the best,
That a motion?
unless there's anybody that would offer up some other suggestion. That will be my motion.
I'll second.
All right, a motion second for that regular scheduled meeting, April 27th at noon in the BOCC room. Roll call, Mr. Matt,
Aye.
Mr. Compton,
Aye.
Mr. Taylor,
Aye.
Mr. Davidson,
Aye.
and Barnes is an aye. Thank you very much. Any board comments? Mr. Matthews?
None today, thank you.
All right. Mr. Compton,
No, thank you.
Mr. Taylor,
No, thank you.
Mr. Davidson.
No, thank you.
Very good. And no comment for Barnes. Would entertain a motion for recess until April 21st,
How
noon.
about a motion to recess to April 22nd, Wednesday at noon?
Okay.
BOC. Second. We're not meeting anywhere else. I know, but I think we still have to get it on the record.
All right. Got a motion and a second to recess until Tuesday,
Wednesday.
April 20th. I'm sorry?
22nd.
Are you? Wednesday, the 22nd, is that correct?
Yes.
At noon. And roll call, Mr. Matthews,
Aye.
Mr. Compton,
Aye.
Mr. Taylor,
Aye.
Mr. Davidson.
Aye.
Barnes is an aye. Thank you, gentlemen, very much. Appreciate your time. And meeting stands in recess.
The juries are canceled until June. Yes. So do the first we can do. That's good. So, and at what point